got the word with Alderman Hopkins, and so I went to his event to volunteer, and I think that was super helpful and super important for
Oh,
me to see the
thank
run
you.
of the
Yeah.
show, to understand all the pieces that sort of had to be locked in before having a further conversation with Jewel Osco. But I think the first step was to find a venue. So we had to find a spot in the ward that was ADA accessible, that was sort of centrally located in the ward, and that could accommodate the flow of the space. And so the flow of the space, roughly, as an intro, and we'll get into it, and I have also a bunch of documents that I'm totally happy to share, was the sort of like eligibility entrance forms section. So that's like the first point of contact. Actually, let me pull this up right here and share my screen.
Leslie, do you have an event planned?
No, we're still waiting on a date from Jewel. We think we're hopeful that we might be looking at the 25th or May 1st, but they said nothing for at least 2 weeks. So we're trying to like get them to give us a firm date so we can really get the ball rolling on these things. Because I know kind of some of the other folks have been given like a 6 or 7 day window, and that's a little chaotic.
Ours is 6 days. Yeah, it's brutal.
It is brutal, but that's we sort of like we were like, okay, we're gonna make it happen because it's important, and otherwise we had heard that we were gonna be pushed a month out, and at that point we were like, we should get 1A, 1B, 1B plus to the folks who have been asking for it the most. So I don't know if you can see the spreadsheet that's 325 vax event facilities needs. Can y'all see that?
Yeah.
It's a little hard to read, but
yeah.
It is hard to read. Okay. Okay.
Yeah.
So
well, I'm on my. Okay.
Yeah. Again, I'll share this with you. This is just kind of to give an overall understanding. So these were our stations. So our stations were like entrance, and that's where we had the folks who are checking temperatures, and that's. We have the temple. We had the temple thermometers, and we had volunteers sort of checking temperatures. And if their temperatures were 100.4 or above, then we couldn't let them in.
So I have a question right there. We were told by Jewel that that's not required. Was that your understanding also?
Yeah, it was. It's not required by Jewel Osco, but obviously we don't want to pass. Since it is a COVID event and we were maintaining COVID protocol, that was a priority for us. We wanted to make sure that we didn't have anyone who potentially had COVID or had a high fever who was coming in because it was kind of close quarters. So it's not required by Jewel Osco. It was just a COVID protocol that we wanted to maintain.
Okay, thanks.
And then so like at this point, you will have gotten something from Jewel Osco or your whatever provider that is an informed consent form, and that's basically a check from the CDC with a bunch of like, hey, are you pregnant? Do you get anaphylactic shock? Do you have an allergic reaction, etc. to stuff in the past? So that form has to be completely filled out because that's a form that Jewel Osco takes at the end of the day. And so this is the place where we checked for people's IDs, people's like proof of address. If you're doing that, when we registered people up ahead, we said, hey, like we really want to make sure that folks in the ward have priority. So put in your address and bring your documentation with you. Not necessarily that we checked them on it when they came to the door and said, well, you're not in the ward, so you don't get registration or you don't get to, come in. But it's just a sort of preemptive measure to make sure that people who register, people in the ward have priority to register. So we asked for ID, to bring any insurance information, proof of address and this completed informed consent form. And so we had volunteers checking for that. And then that's where the line started to get inside the building. And then they would hit registration. And so this is the thing that, you know, equal pros and cons. So we did our registration through Eventbrite. And I don't know, Ginger, what y'all are thinking about doing.
We're done the same.
Okay, great. Yeah. And so Eventbrite lets you segment out your sections and put a cap for each section, which is what, you know, we needed to do because Jewel-Osco has basically told us for our given space, they were looking to vaccinate about 50 people per 15 minutes. And so they gave us the exact hours that, you know, they were going to be on site. And so we created sections, blocks of 15 minutes and had 50 tickets per each spot. And then what we also did was in our Eventbrite is, and I will open that up because that's helpful. We asked additional questions that would sort of like help us understand the audience further. And you can customize the questions here. And then they also have really cool features like building a wait list and, you know, managing your attendee list like through the app itself. And you can send emails through the app, you know, through the platform itself. So we just settled on this as the best way. So this is how we did it. So we, again, like I said, we broke it into 15-minute slots and then put in this little cap of here we have 47 in some cases, 57 in some cases. That's just how the slots worked out. And then in your,
does it let you export the people who are SVP to a spreadsheet?
It does, yeah. Based on any kind of status, you can export the whole, you know, the whole sort of cool. CSV. And so this is what our like splash page looked like. And we wanted to provide as much information on the front end as possible because I think the goal, right, is to have to register people here that you know are going to come through. So you have to sort of make your messaging really clean and tight on this page. And so we basically said, these are the phases that we're looking to sign up and register. And, you know, please only register if you can receive both the first and second doses at the location and the dates provided. Jewel-Osco gave us a couple of fact sheets and all that. You can, you know, link all of that. We also used a link tree to house all of these things because it's at some level there's just a bunch of links that they're going to have to go down. We put the informed consent form in Andre's link tree as well so that they would have it all in a one streamlined place. What we, in hindsight, you know, this would have been great to do in different languages. We just didn't have the time to do it, to sort of translate everything in the short time that we had. But yeah, make your messaging sort of like super clear. And then we also put a map to the parking and the setup, because if your parking is a little complicated like ours was, any amount of like help in a map form, like clearly communicated, is very helpful. And so that was the how we set up the tickets. I'm trying to see. Oh, okay. Just a quick little note in this tickets section. So I'll take an example here. Here in edit ticket, you know, obviously you want to, you know, make it a free ticket, name it whatever you want to name it so that it's clear. Put your quantity limit on this side. The start and end time is extremely important because we had a bit of a hitch and we had to sort of change it when we noticed that people were getting error messages or they couldn't sign up. So you basically, for each of these sections, you have to input a start date and time and an end date and time. It basically says like this is when it opens up for each of these sections and this is when it closes up. And so I put the day before, I closed it the day before because we wanted to make sure we like had that cutoff and we could get our wait list together the day before. But what happens is that Eventbrite, if you have the wait list, then if someone cancels, the spot just sort of like opens up. It doesn't pull from the wait list. So you have to make sure you end your sales and then like read the wait list settings and like tweak it to say, do you want it to pull from the wait list? Do you want it to be manually added? Or else if your sales window is still open, it is sort of just like open to the public if they have the link. And so some people, unfortunately, until we caught the issues, some people signed up as people were canceling and we weren't able to fill it from the wait list, which is actually the chronological method. So I'd watch for that because that is a kind of hitch. And then here I would also make sure, because if you don't put a minimum in of 1, then you run the risk of someone buying up the whole stock or like some amount of the stock. So make sure that it's set to visible, make sure it's set to this minimum quantity of 1. And then I also, the default here is for it to be an e-ticket only. But we were dealing with some folks who might not be able to print out an e-ticket or like didn't have access to a computer. And so if you click the will call, then like that signals to when you download it and register it, download and export the CSV, that you'll have that too. So if you have folks who aren't able to provide an email or aren't able to provide bring a print out of the Eventbrite, and like we specifically wanted to include those people, click the will call. So those are just some notes. What I'm basically trying to say is put some time and thought into the way your Eventbrite is set up, because it can come back and bite you in the butt if you don't properly do it. Underneath this order form, you can customize information that you want to collect, and you can add specific questions. And so they didn't have a phone number question, and so we included a phone number. You can click whether or not it's required in order to submit, or if you just want to include it. And then we also, this is where we added our vaccine eligibility category as well, so that way we could prioritize people if we saw that it wasn't in the prioritization that we sort of like wanted. And then we also added an age, because there's no default age here, and we just wanted that data. So are there any other questions right now that y'all have?
Yep. I mean, we've already released ours, but I was just curious, how did you release it? And did you give people a heads up that the link will be released at a certain time or whatever?
Yeah. So we wanted to prioritize older adults, and we wanted to prioritize teachers. And so we had that same sort of like 6-day turnaround once we knew the location. So the first 2 days we had volunteers and our staff reach out to specific groups of people in those categories. So teachers, we sent the link only to teachers. We called sort of senior living facilities. We called teachers. We had our call crew go through our census-based van list, just our call list, and we sorted it based on 65 plus age-wise. And so we sort of did that initial push before we released it to everybody else. And then we sort of communicated the day before that we were going to release the link to everybody. So everyone, this is a good or bad thing, and Andre can speak to this, because once it's in the public, you just get a ton of questions to your info line, right? Like where's the sign up form? Where's the whatever? And in order to avoid that, just release it to the select few, to your prioritized group, and then sort of release the flyer and release the link with the sign up information and all the other information. So you don't get like a ton of harried calls being like, where's the link? We don't know what's going on, blah, blah, blah. Andre, anything you want to add to that?
Yeah, I mean, I'd say, I mean, you all know you've got your vaccine hunters that are ready to go as soon as a link goes live. So we wanted to make sure people knew the event was happening, didn't put out the link yet, but then Pooja and other folks, we'd get the principals to send to like the teachers. We would send it to the block clubs to get their neighbors right on the list first, knowing that when the list went live, it was just going to fill up in a matter of like hour or two. So I think that's something to definitely highlight, because if not, you're going to have a whole bunch of folks that aren't from the ward or aren't from the area that are just automatically going to scoop that up.
Yeah, that's where it gets really interesting. Now, it's interesting. We're doing it a little bit differently, and I don't know which way is best, but the way you kind of did it at the front end, prioritizing, and we're kind of doing it at the back end. We're having 75 slots per 15 minutes, but what we did is we took out a percentage of those from Eventbrite, and we're saving those for people who don't have seniors, and mainly who don't have internet access. So that way they can call us and we call them back and set the appointment for them from those reserved spots. So
yeah, I think maybe like learning from it and hearing it might be best served by doing both, right? You keep a certain share that you don't let go of. On the front end, you try to load with locals, and everyone else will fight for the rest.
You know what? I guess in a way we did do both, because we gave certain groups a heads up that it was coming out. Like as you said, senior buildings, essential workers in restaurants, things like that. So yeah, you're right. We did it both.
And I think, I don't know how you all are, but we've been really trying to make sure that the block clubs are kind of an extension. So we find out what's going on. So by even hooking up like the presidents and being like, hey, send this out to your people. Don't put on any other lines. Like it did help tighten up that relationship even more. And then they understand how they're a part of it all.
Okay, that's a good point. I think our block club system has kind of been really dying out lately, but that sounds like a good way to revive it.
Yeah.
I think ours is once it gets scheduled, we were going to do the front end as well, do some targeted outreach, and then open it up to the broader public is kind of what we've discussed. So it's kind of, it's nice to hear kind of both sides of this.
Yeah.
And I would also add that, like, if this is where we got sort of like caught up, because in the waitlist in Eventbrite, it only, you can't, like I showed you, you could add this custom questions to the main group of people, but the waitlist on Eventbrite, it only allows you to get your first name, last name, and email address. And phone number. So you can't prioritize, because you can't ask the question of like, what phase are you in the wait list that way? So like that was kind of a learning experience. If we wanted to do a wait list, do it in a separate medium, not through Eventbrite, because then that way you can track what phase you are. Because the wait list in Eventbrite, you can't track anything else except for your first name, last name, and email address and phone number.
Wow. Okay, I didn't know that. Thank you. That's really important.
Yep, I didn't know it either.
Okay, I'm learning a lot here.
Yeah,
absolutely.
We definitely had at the end, once we had everybody with the shots, had a list, and we just started scrambling, calling people we knew, calling whoever on the list, trying to figure it out. Ended up with like 200 people. Then had to tell some like we're out of supply. But even then, it wasn't.
Yeah, that's.
Yeah, I mean, but to be honest, it wasn't that difficult working the line and kind of setting expectations as you get the information and just being like straight up with folks, because people appreciate and understand that. But yeah, it could definitely be done better than how we did that.
Okay. Andre, quick question. So like people who had not signed up just kind of showed up hoping that they might be able to get one, like 200 people?
It was kind of both, and in the sense that we should have started calling people on the wait list like earlier on rather than like later on. Basically, we noticed that like between 2 and 3 o'clock, we were like, oh, we're behind on our numbers, because in the morning we had sort of front loaded because there were folks who had appointments later in the afternoon, but who came in the morning anyway, because they already had an appointment. And, you know, it's hard when you're there to be like, what is your appointment time? Like, and like be like, well, you're in 10 minutes. You can't come through yet. So we weren't doing that much of double checking. And so we had a front load basically. And so later on, it just kept on like dying and dying. So like per 50 people, we ended up, you know, only seeing that there were like 40 coming through. So we're like, oh, every 15 minutes, we're kind of like losing like between 5 and 10 people. And then, you know, we had everyone start calling the wait list, start, you know, calling friends and family to come. But at that point, it was already like 3:30, 4 o'clock. And then so at the end there, we had like 200 people come at like 4:30. And Jewel Osco was like, oh no, we might have like a couple, you know, a few more doses to administer, but like our people are tired at the end of the day. Like we have a hard cutoff. So like, we're not just going to stay here administering doses. They have a hard cutoff at like 5:10.
Wow.
You said you wish you would have started calling people earlier. Like what time?
Like
started?
10:30, 11.
Well, here's what I was saying to be mindful of. The thing, what Pooja pointed out is exactly right. It is extremely hard to track what you expect to hit compared to what actually got, like who got shots. So that number is going to fluctuate. We were doing, I think Jesse was checking every half hour, if not less, of like, where are we at now? Where are we at now? And that fluctuation is what ends up driving when you call or don't. Because if you think that you're over, if you think more people came in the supply that you have, you're not going to be inclined to call. It's the second you think that there's a dip and you got to make up for it that you then start calling. I think that was one thing. I'm trying to remember the second part. Yeah, I'm sorry, I can't remember the other, but definitely that. Like, it's just going to be hard to track and gauge and kind of just be, if you're doing the regular check-ins, you'll have a better sense of when you want to make a call.
Okay.
And I'll say like, so the night before, based on our appointments that we had, I built like a flow chart so that we could check in every 30 minutes to know how many people like at any given 30 minutes of time, how many people should have registered to make sure we're on track, right? So like at 11 o'clock, right? Like we should have expected 282 people to be there. At 11:30, 376. And then we would like go through our list and say, you know, this is how many people are actually here. And if it was higher, then we were like, oh, maybe we need to slow down and like, don't call people on the wait list. And if it was lower, then, you know, we needed to do that. Start calling the wait list. But again, like people front load and we didn't consider that. And so start calling people on the wait list because you're going to have some drop off. Jewel Osco says like between 5 and 10% is pretty standard drop off at every event they've ever hit. And so just, you should expect that.
Yeah, and then also to Pooja's point, as they mentioned earlier, like they do have a very hard stop. Like they didn't mention it at all, but I remember going back and forth and people would be like, hey, can we do more doses? Can we not? And that's when they started telling us like, hey, we can only do whoever's left or is the line done. So they were looking at it from their lens of like, we've been doing this all day. We're ready to roll. And I think that's something to keep in mind as you prep when it starts winding down towards the end.
Okay.
You know, I'm so glad you're emphasizing that, Andre, because I did have the image that they would stay there till midnight if need be. So I thank you. That makes a big difference. But my big concern is that vaccine doesn't get wasted. Was that a problem?
So that's why we were making the calls to get, you know, you're there 200 people to try to use what they could. But they didn't ultimately utilize all that they had for us. They only did about
the vaccines. Like, are they just throwing them out? I think is the question.
I think they've got to refrigerate enough because the way they were chill about it, you know, they were supposed to give us 15, 16. We ended up with something like 14, 16, right? And I would watch them and they would look at each other and be like, do we do another batch? Yes, no, all right. Right. So like they've got their program ready. I don't believe that they would be that chill if they were just losing 100 vaccines.
Okay.
So
yeah. I think that's like to Ginger's like hard stop I can respect because I think they're doing these every day and that's a lot, you know.
I mean, and there was 60 every 15 minutes. They're like clockwork. They don't like I respect it just on execution.
Sure.
Wow.
Okay.
How many setup tables did you have for or not setup, registration tables did you have?
Yeah. So this is the, yeah, I'll send this. So this was sort of like the flow of it, right? So that was the entrance eligibility. The second was the sort of registration, the computer registration. So we kind of had a very tight space, and so we had to sort of flow inside and outside, but you want to have like 8 people on registration at any given moment, especially for that front end. And there's going to be times when there's lull and it seems like, oh, 8 volunteers is too much, or 8 people doing registration is too much. Gotta have it for that massive influx, because they need to stay on track. And when there are 60 people, or sometimes when there are 80 people in line, they still got to stay on track and people still have to be registered. So we had 8 people on computers. Make sure, y'all, to like get Wi-Fi hotspots, get power strips, extension cords, as many extras of each of those things that you can get, because those are necessary things in this world. And if you don't have them, or if something sort of like goes off, if you have a blip, I mean, it really crashes the whole entire thing for a while. We had a moment in which, so we were supposed to make copies of all those documents, right? The
Right.
driver's license, et cetera, et cetera. We had an issue where all our printers and copiers just like were jammed and we're done. And we had a massive line backup of like, I want to say like 80 people. And Julasco was just like, cut the copying. We're just going to go. You don't have to copy. We're not taking any information from folks, because we have to like move these doses that we've prepared. So I think they're going to still want copies and stuff for y'all. So I would just make sure to like troubleshoot your tech the day before. Make sure you have a bunch of these power strips and these like Wi-Fi hotspots, because they're massively important. Anything you want to add on that, Andre?
Well, I didn't know about the 80. I was there smiling the whole time. Like things are going great, right? But I think to that point, now you all know that should that occur, Jules gonna keep going anyway, right? It's not gonna, you're gonna have that fright and that tension when it happens. But I think hearing the fact that like they're gonna want to keep moving, ultimately you'll be like, hey, can we just, let's do what we got to do. We can't find other printers within an hour. Let's just keep working. Yeah.
How many copiers did you use?
We had 3 printers and like 2 printers with copiers, and like 2 of them were being used to print extra informed consent forms, which you'll need. So make sure you print out a ton of extra informed consent forms that have the date of today and the date of your second appointment on them, so that you have extra. So we had 2 printers printing those extras, and then we had like those 3-4 other printer copiers making copies. But again, there was a moment where just it all exploded, and Julasco was like, you know what? We don't care about that. Let's just move. Let's keep moving.
Okay.
I would also say, and I think Pooja will go into a little more of the crowd control, but I just want to throw out there that like whoever is going to be, I recommend that the elected is the one working the line. Like you're going to have your team doing it. But for me, I was able to do all the handshakes. We gave them all cards about how to contact the office, crack jokes, kept it, I think I'm looking at Leslie because me and Maria both work for AT&T. So like it is very much that customer service greeter feel that if you're doing that, you can maintain that line. I also, what I had done is put the tape every 6 feet and just kept walking people through, hey, here's what it's going to be. You're going to be 6 feet apart. You're going to go to the first place. Then after you get a shot, you got to survive 15 minutes. Once, just walking them through and making them feel like cool as it's going through. So when the jam up happens or something like that, you're just working the crowd on the front end and letting your team do what they need to do to make sure that they're on point.
So I have a question right there. So Harry's attitude, it fits in with yours, like, let's make this, a fun event, all the rest.
Yep.
Our chief of staff is more like, no selfies, no socializing, get them in and out. So it's interesting that you tried to make it a pleasant event.
So that's a really good point. So one, I made sure that we had volunteers that had cameras and did the smartphone and were recording all of it because we want to be able to tell the story of what we did.
Right.
While they're waiting in line, I was able to do that. Like, hey, if you want to take a selfie, use this hashtag, because they're waiting in line, and this line gets long. They'll be waiting, they're not waiting too long compared to what they're getting, but they're there. And then
Okay.
the other thing that occurred is we had a space for people to wait for 15 minutes, but it was so much coming and they were processing so quickly that room ended up getting filled, and they actually had to do a space outside for people to wait 15 minutes as well. So those are good opportunities to schmooze it up, talk to them, do all of the above, because they're done and just sitting there for 15 minutes too.
Okay. Okay, got it. That sounds right.
The majority,
we're doing selfies.
the majority of folks are very thankful to be there, but like, people do have to move their days in order to like hit the appointment slots. And if they don't hit their appointment slots, some people are a little like anxious and angsty. People are also just anxious about getting the shot, right?
Sure.
Like in general. And so like, it's really important to have the Andres of the world be out there and the greeters of the world be out there and be like, hey, cool, everything's cool. Like, this for the greater good. Like, this is important. Thanks for being here. Like, y'all great. Like, that's super important. Yeah. And like, we had all our volunteers are excellent. We're stunning. So like, make sure you call on your most happy, most charming volunteers to work this event, because like they are putting in hours. And like, our event, there was a slightly chilly day in the morning and it got sort of warmer, but like also weather, right? Make sure you're like prepping for if you have any particular weather situations. Like we thought we were going to have rain and people were going to be waiting outside. So we like tried to get as many tents as possible. So at least our volunteers and our forums wouldn't get rained on, but like really watch those things too. That's pretty critical.
Also feed your volunteers, but you will already know that, right? Like you want to keep their spirits and energy up, because that is very much what drives a lot of it. If people are like, cool, you all seem like you're happy and it's going smooth, I'm going to feel like it's going smooth. They don't know any better. So that was like extremely helpful. And then we also had like a couple floaters and like our staff that was bouncing around from place to place, making sure, if there's a hiccup, that we can just intervene and help out.
Okay. Sounds good. Yeah, that was another controversy. One staff person wanted to like open the volunteering to everybody, like send out a mass email asking for volunteers. And I was like, no, we got to have our A team on this. Only people we know are going to be helpful. And we're sticking with that.
Have you heard from they call themselves the Vaccine Brigade?
Yes, I have. In fact, I have a story to tell on that. The person who founded that is Peggy Dublin, and I went to nursing school with her at Rush and graduated in 1979 with her and lost contact with her, but now she has arisen. So they seem wonderful.
Yeah, so we've been in touch with them. So very excited. That's part of the hoping it's a well-oiled machine, because they're jumping around to all these events, making sure it happens just out of like the kindness of their hearts.
Wow.
Which is awesome.
Right.
And obviously we'll draw from other volunteers, but definitely.
Yeah.
And then we have the Loyola Community Nursing Center that I'm hoping we can tap into as well.
Yes, I'm working with them also, Monica Dillon and Lisa Scump. Yeah.
Yeah, I think for us, we had our folks who we just know throw down, have done it before. We also like did the broadcast, so we had people in different roles based on how people knew they were going to execute. And then thankfully for us, we had Swedish, who also like helped out with space and a little bit there too.
Cool.
Okay, so did you actually have nurse volunteers give vaccinations or draw up the vaccine?
No,
Jewel Osco is not about that.
Okay, they're asking us to provide nurses who can draw up the vaccine.
They asked us for that too.
Yeah.
Interesting.
Yeah.
Nope. We had nobody touching it.
I'm wondering if there's just burnout on Jewel's side.
That makes a lot of sense. They had us pull licensed nurses for the observation. So we did have like 6 or 7 folks who'd been clinicians before or are currently clinicians to do the observation, but they were like, we're not going to do the training to do the drawing.
Interesting.
Okay, that's so interesting. They're really having a different attitude now. It's like, sure, get anyone you can, draw vaccine.
I mean, if you figure that out, then you don't even need them. You just need the supply. Just send it on through. We'll get the rest done, right?
Yeah, just
Right,
drop
we'll
it off at
eliminate them.
7 a.m. We'll take it from there.
Yeah.
And then we will use every vaccine.
Right.
Right.
We'll be there later.
Yeah. Oh, let me ask this while I have you on here. We're also
Yeah.
trying to figure out Walgreens, CVS, and like other folks who might have supply, because I'm just thinking, and this is what I told the team. Jewel wants to get their brand out there as like, look, we're the heroes. That's why they're doing a lot of it, as well as doing the good thing. So all the competitors would want to do the same. And if we say, look, our operations are tight, we've done it already, come bring the supply. That's what I'm trying to get to. I just haven't figured out the context for the other two.
Maria has a contact for Walgreens. I'll ask her to get it to you. It sounded like they were open to it, so we want to have more too. I don't know about CVS.
Okay.
You would think.
I sent Maria that contact today. It's Donovan Pepper. And I can send
Donovan.
Do you know Donovan?
Yeah, I mean, I call him on call time, but I haven't had a chance to get through to him for a while.
Okay. Yeah, he's a good guy.
Yep.
So we're getting a lot of requests for a repeat event already. Have you gotten that?
Oh, yeah.
They get the request from me, unfortunately, because and this is a government call, so I won't say why. But literally everybody in the ward knows when you do one of those. And so we did on the west side. Why not do it on the east side of the ward, and then maybe focus on like refugee populations or other folks who don't have access, and like figure out how to do them. Yeah,
Right.
Yeah.
We had one person email us that this was a great idea. Please do it every day.
Sorry.
Yeah.
Oh, man, we could.
Yeah. Right.
Whole different ball.
I wonder what Prism's doing, by the way.
No.
I mean, that's the thing we're trying to figure. Oh my gosh.
Here's $15 million. We won't ask any questions.
Oh God.
Well, here's the thing, and this is all us talking. Like Wrigley Field, nobody gets a heads up. Like the city itself just is not doing anything to include us, and so we're here scrambling on our own trying to figure it out. It's not cool.
Makes sense to have like
Right.
board staff and volunteers.
Right. Let's just drop everything for a week and then see if we can execute.
Handle vaccine dissemination makes total sense.
Yeah. Well, yeah, for us, we were trying to like be patient with DPH, play by the rules, give them a chance. And wow, we found out we got a lot of unhappy people that are, especially elderly ones, that can't make it down to the United Center. Sorry. So
Yeah.
No, I mean,
it's up to us. And so,
I think we realized this summer when we did our own community testing events, we're like, okay, so we're just kind of like here on our own figuring this out.
yeah.
I think that's what ended up pushing us a lot more is once we had, because Harry, we all had a meeting, right, to try to schedule a meeting. They didn't do that. Once we had the hearing and it was going to, as soon as they said we weren't having a meeting, I was like, nope, we got to figure it out on our own because they're just not going to help.
Yeah.
Yeah.
Okay.
So real quick, just to go through like
better.
I just want to go through quickly like the rest of the sort of stations, and then y'all ask the sort of rest of the questions.
Sorry,
that y'all have. No. I totally get it. Aldermanic tangents are welcome.
It is a commiseration,
Yeah.
I just got to get to my Airtable after this, so
Let's go. No.
So okay, so yeah, the registration, definitely have like at least 8 people there. Tell them to bring their power cords, and at this registration station you also ask, this is where you have your downloaded list, your Excel list downloaded from Eventbrite that says this is the name of the person, this is the first name, last name of the person. They show you again their informed consent form, their address, their ID. You mark them as like attended on this list so that that you can do a count, however often you want to. You could do a count of how many people are registered. That was a critical step for us. So that's sort of like the main document, this sort of like downloaded Excel spreadsheet from Eventbrite. And then at that point, we sort of like sent them to the vaccination. Again, like there's crowd control between each of these steps in order to like keep people in line, maintain 6 feet, maintain COVID protocol. We also got masks. We got extra masks and a bunch of hand sanitizer that we just like had out so that people were like, if they dropped a mask, needed a second mask, etc., they could like ask for it, use it, and feel like COVID precautions as much as possible. And then so we had 12 vaccination stations set up, and Jewel Osco will give you this requirement of what they need, but I'll pull it up here too. So for each vaccination, so they need 1 dose preparation. I think they ended up using 2 tables, these like banquet tables for preparation station, and then they had 12 or 10 rather vaccination tables. And then for each vaccination table, they had 2 chairs, they had 1 garbage can at the end of it, and then they wanted signage, you know, that looked good and unique and identifiable for the crowd control folks who are like, okay, now you go to table number 10, go to table number 9 type thing. And then that's each vaccinator takes your form once you sort of like get your vaccination. They take your informed consent form and any copies that they have, and they sort of put it away there. So they have their own like document collection station at each station too. Any questions on like the vaccination station?
Where did you fit in the giving out the CCD card?
Yeah, so that was our next step. So right before the observation station, we had like a table, and that's where volunteers would give an individual who has received the vaccine their CDC card and their informed consent form that they have to fill out prior to the next time. So, and there was like some other, Jewel Osco had this like coupon that they wanted to give out to folks or something too. So that was like where they got that package. One major thing here, they gave us a sheaf of CDC cards the night before, and they were just like, give these away. And what we should have done that evening that they didn't tell us, that we realized later, is that we should have written down times on the CDC cards for people to come back the next time.
I was just about to ask.
Yes, or you say in your registration document, you say, please only register if you can come when you register for your appointment that same time. If you can come the same time for your next appointment, then register. So like that, there's 2 ways to do it. We wanted to give a little bit more flexibility for people who had differing schedules. And so we wanted to give people the option of like picking their new time when they came in, because that's how Hopkins did it. And like, we understand that no 2 days are going to be different for people's schedules. But what we should have done is, because these cards did not come pre-marked with the times, you have to measure out how many ever doses that you're getting, those, same number of appointments. So like 50 per 15 minute, you have to hand write them down yourself, or like stamp them or something on each CDC card, because they don't come with the times. They only come pre-printed with the second shot date. And so this is again to avoid the influx of 100 people coming all in one 15-minute block for your second dose, because they don't provide that on the pre-printed cards. Does that make sense?
Yeah, although I'm still a little confused. I thought the person who, now correct me if I'm wrong, and I must be, I thought the person who does the vaccination actually had to sign each card, but apparently not.
They don't, no.
Oh, okay. So
they already have some of the stuff pre-printed.
Okay.
Huh. Yeah, I'm looking at mine, and it has a signature from the healthcare provider. This was from the city site.
Yeah.
The one that they gave you? Because I thought all CDC cards looked the same.
So the cards themselves look the same, but like, for example, like yours, someone manually has written the date.
Yeah, but they also, like, she's, to her point, there's a signature.
Right. So that was those things were pre-printed. Everything was pre-printed except for the time. So Jewel Osco did not have to hand sign their signatures. They had like the initials of like the manager or something on the card pre-printed.
Oh, okay. They didn't make that point clear, and that's okay. Thank you. That's helpful.
I would ask them because their process changes too. So like I would ask them like their current set of sheaf of cards that they're handing out, like what does it have on it and what, like who needs to sign what, because that their process has also evolved. And so I would just like make sure to ask that question. And then if you can also ask if they can give you the cards pre-printed with like time on it too, like, you know, that is potentially one option that they could do for you. If not, then you have to hand print out the times. And so we had volunteers just like very quickly scramble to write down times on the cards so that we would have like, again, the same 50 people per 15-minute time. And then I had the night before again measured out how many people per appointment. And so like had an easy way of marking off like, okay, there are 50 people from 9 to 9:15. So like write 50 of those cards and then go on to the next 9:15 to like 9:30 slot.
But you don't actually write their name in it. Do you leave that up to the patient? Yeah. Okay.
Quick question, Pooja. You mentioned that you wish you would have maybe said only select a time if you're available for the same time 3 weeks from now, but you wanted to allow flexibility. Did you end up then just saying you're coming back in 3 weeks at this time? Like,
no, we had volunteers like make like write down these. So like for each time slot, there were 50 cards per time slot. And we just said, hey, what time do you want to come back next time? They would hand out the card to the person. And if that time slot filled up, they'd be like, oh, we don't have that time anymore. Can you pick like another time that we currently have?
I see. Okay.
Yeah. Because we did want to, again, maintain that flexibility. Otherwise, we could have precluded some folks from coming back if they already had scheduled like doctor's appointments or like important meetings or something on that day that they couldn't get out of. We wanted to give that flexibility.
Yeah, and I think we talked about it internally. We're concerned that people don't remember the time they have to come, even though they got the card. So I think we're going to tap into the vaccine brigade to just call people and like try to reinforce that in advance.
Oh, great idea. Okay.
Interesting. So you handed them a card. Did you also have a computer there so you could like enter it on the computer and be like, Joe Smith is coming back?
Did not do that. Would consider doing that if you want, so that we could so that you can have that record on hand. But like we didn't think to do that ahead of time.
Yeah, and if you're gonna do that, then you got to figure out who's gonna do it and get that plan in place, right? Because everything else is gonna be going at the same time.
Yeah, that's something we'll have to think about. Yeah. If we just want to be like pick a time that works for both shots, or how we go about that. Because like you said, if they forget their time, and now you're like trying to figure out how to follow up with folks. All right.
Yeah.
And I will say, like, Jewel Osco, when I asked Emmy today, she was like, if they don't have their CDC card when they come in, they can't get their second shot. Like, we're not going to give them their second shot. Jesus. So, like, they have the card with the time on it. And so, like, if they have the card, they should know the time, right? But if they don't have the card, then they're out of luck.
Was that clearly communicated to them at the event?
No, because we didn't know that up front either. I just happened to ask Emmy, like, hey, like, anticipate some people missing their CDC cards when they come in. If we have them registered here, like, what can they do? And Emmy was just like, they have to have their CDC card with their first shot on it, or else we don't have a record to say that they got it. And so, like, I'm gonna try to push her on that.
You still have any CDC cards that you can
well, but here's the part I think you do. If they collected all the informed consent forms, they obviously were keeping track of something to have that data. So, and the reason I say that, we had a neighbor from that said that Walgreens gave him a first shot, but then they couldn't get a second. And they had to keep calling, and ultimately somebody did track it. So I think it would make sense to push a little bit and just see if it isn't somebody who's there on site, like they come without their card. Hey, we can't do it today, but there should be at least some process of like how can they follow up to see what's up.
Right. And
Yeah.
the window is like 4 to 5 days from the after that 21 days, like you can go up to like 4 more days after that in getting your second shot, because I'll talk about the wait list and more information that we just found out from Joe Lasco recently. But yeah, so that's this is how, and this is how we had it. Like, you might say, hey, we might do the registration and the handing out of the card at one go, like on the front end. When we do the computer registration, we go, and what time are you coming back next time? And put it in the computer registration there. But we knew that Jewel Osco wanted to have that steady stream in, and we didn't want to like have people check their calendars and do all that before going in for their vac, so we did it after the fact.
Okay.
And then again, some crowd control here too before going into the observation room. And then also make sure to have like 4 volunteers on like sanitation duty, because, you know, got to wipe down chairs, got to wipe down like pens that are left behind, got to wipe down surfaces and stuff in the observation rooms, because people are like sitting in that. So Jewel Osco wanted 80 chairs spaced at 6 feet apart for their observation room. And like, that is critical. Listen to them when they say 80 chairs. We were like, oh yeah, we got 60, like no worries. And the reason for that is, when you do that informed consent form, if you check yes to any one of those categories, you have to wait 30 minutes. If you check no, then you only have to wait 15 minutes. However, because we were prioritizing folks that had underlying medical conditions and are likely to check the yes on one of the boxes, we had the majority of folks waiting for 30 minutes. And so like we needed double the capacity, and the minds of our brilliant volunteers, they were like, oh yeah, we'll just set up like an overflow space outside, because thankfully, again, the weather was okay. And so we could have some people sit at 6 feet outside too. And so like we almost, you know, like by a quarter to a half, like increased our seating capacity of this from the 60%. So we had like up to 80 folks at 6 feet apart sitting at any given moment, the ability to handle that.
Super quick. I have a 7 o'clock I got to jump to. So Pooja, I'm going to make your co-host. Then I'm going to get off to get ready for the next meeting, because that's the life. But thank you all. And hopefully once everyone's done it all smoothly, we can do a joint one at Warren Park or something and be less headache for everybody. But
I would love
fingers
that.
crossed.
Well,
Yeah. Thank you, Andre.
Sharing your wisdom with us.
Yes, it's helpful.
You all would do the same, and thank you for doing all the good work. So
Sure.
Thank you. Take care.
I gotta make you post those, because I'm about to come to the next.
Pooja, approximately how many total volunteers did you have?
Yeah, so this is the number of volunteers that we had per shift per like station, but we had about 40 volunteers in the morning shift. That was 5 hours. So we told people to come at 8:30 and leave at 1:30 for the first morning shift. And then we told people to come at 12:30 and leave at 5:30 for the second shift. And we had 40 folks per shift broken out into these sort of station categories.
Wow.
And then what we now are doing for the next event is that we're asking for 10 people to come set up in the morning. And naturally people are going to stay and help to do breakdown after, because they're just more energy at the end of an event versus like early, like super early in the morning. Hey, I hit record. Okay, thank you, bye. Yeah, did that answer your question?
Yeah, thank you.
Yeah.
That's very helpful.
I would say no less than 40. And you have, it seems like, are they planning on doing 1,500 doses, or are y'all doing the 2K?
We're doing 2,400.
Okay, I would definitely, if you're roughly, I would like double the amount of all the things and volunteers based. I mean, again, this is all based on what Jewel Osco is asking for and what your space looks like. And I don't know what space you're doing it at, but like for that size of people and for making sure like registration, again, I said 8 people is necessary. I would say base, y'all should have like 12 people maybe.
Yeah, we're doing 14 at
Great.
registration, because we figured that'll be the key choke point.
Yeah.
that and the copying, but so it's very reassuring when you say we can screw the copying if we have to.
Yeah, I mean, Jewel definitely like wants the record of the information, especially because they're trying to push as much through insurance as possible. And some people don't bring the copies of their insurance information. So like if you can get that set up, like that's chef's kiss. But like if you can't do it, they're not gonna be like, well, the event's canceled. Go home.
Okay. Okay.
You only had one photocopier, or how many did you bring?
We had 3, but like they all broke down. One was jammed because we were like trying to print 2 at the same time on it.
Bring their health insurance information if they had it, or just like their ID?
The health insurance information too.
Oh, geez.
Yeah.
Okay. And do you just like just photocopy, make a pile, and they get to sort through it, or like...
No? So you give it to them.
Okay.
I mean, you can do that as well, but we were just like making a copy, giving it back to the person who's getting vaccinated. They would walk with their sheaf of papers to the vaccination. They would have that stapled. So the registration, in an ideal world, the people at the registration would staple all of these things together. The person getting vaccinated would walk to the vaccination room, give the sheaf of paper to the person who's vaccinating them, and then that's where that lives.
Okay. Yeah, they're wanting to get...
That's ideal. Yes, they are. They are.
That's what
It's fair. And then we had around like 2 to 3 observers, like walking both inside and outside our observation room, watching for people who had symptoms, just like checking in, being like, you doing okay? Do you need anybody? Jewel Osco has a point person who will be like, hey, if someone starts to like have a reaction, go hit that person. So make sure those volunteers know who that Jewel Osco person is in the vaccination room to go quickly run and snag them if something happens. We had one person have a reaction to something, and it wasn't a major reaction, but like she passed out. And so she needed like rehydration. There was a nurse watching over her. And the Jewel Osco person sort of like came in and watched over her too. But that was like the only incident we had. So like some stuff could go down. So I would also like, when you're doing the space, make sure you have like an emergency exit like situation, or have like a way for like an ambulance to get in. Cause it is a medical, it's like not a procedure, but it's like a shot at the end of the day, and you could have a reaction to it, and you might need emergency services to come in. So make sure like you have that in the back of your mind.
Okay.
Yeah, okay, so that's the major of the stations. We also had a break room and like a rest area for volunteers. That's where we sort of like put our lunch and our snacks, and volunteers who needed a break would sort of like just chill in there and like get a little rest. And so those floaters that Andre was saying, like we had a couple of folks who were just like, were volunteers who were checking in on other volunteers, being like, hey, if you need a break, I'm happy to switch in with you for you to take like a little break. And like that was, I think, super necessary for people working those like 5-hour shifts, right? And then we had a parking, so our Swedish partnership was basically they let us use our parking lot. And so we had to funnel people into different parking spots and make sure they didn't park outside of the free parking right in front of River Park, because we didn't want them to park in the residential area that was permit parking only and get ticketed or anything like that. And so we did let know like Department of Finance the day ahead to be like, hey, like try not to enforce if you can help it in this area, because we have like a major event. We talked a little like traffic control and like make sure we had the flow established. We work with our streets and sanitation office the night before to put up like no parking signs in the area in front of River Park. And we were saying like no parking, we have vaccination event. This event is like reserved for vaccination folks. And then we like used their like sawhorses to block off like entrances, because if you don't regulate that, people will just like come in and out in a not orderly fashion if you don't have like enough crowd control volunteers. But even still, like having the sawhorses and having sort of like barricades for a flow, that's pretty important.
Okay.
I mean, that's really it. Besides that, like these are all the things that we thought that we like needed to get extras of, and it's just really nice for setup to have this like in a really organized fashion, so that day of setup, because I was running point on this whole organization, right, but I needed to communicate this to the volunteers and the rest of the team. So like the day of, for each sort of like location, station, make sure you have all the things that you have to have in that station. We sort of mucked up one time. The informed consent forms that were for the day of got sent to the pile for the next time. And so Jewel Osco was like, people are coming in with signed informed consent forms for the next time, not this time. And so like really mark what has to go to what station and like have that setup crew, and like whoever's the point person, like do a double check of like all the things that have to be at that station beforehand so that you don't run into any sort of snafus.
Okay.
Yeah, so this was our sort of like list. Staplers, masks, extra masks, hand sanitizers, pens, clipboards. Get a lot of pens. Get all the pens. If you're having 2,400 people, get 2,400 pens, because people are gonna like take the pens after they fill out the informed consent forms, and you're not gonna have any pens left.
Okay, that's a good tip.
And the sanitation stuff, we didn't have enough Clorox, so like after hour 1. We ran out of Clorox, and so these poor volunteers were using hand sanitizer and paper towels to clean off the chairs.
Oh, okay.
And then they finally told us, and we're like, we need to get more Clorox. Like, don't be doing this. What are you doing?
Oh my gosh, that's so funny. I just gave away a case of Clorox that I had stockpiled to Craigslist, so now I'll go buy more.
Yeah, no, that's definitely keep that in mind. And some volunteer feedback was that they felt like they were really, again, happy with like the food and the snacks and like the hand sanitizer and stuff, but they wanted these sort of like N95 masks or like face shields or something, because they were there for a long time and had to interact with a decent amount of people. So like whatever you can do to make your volunteers feel extra protected on that day.
Good point. Yeah, good. I'm just curious, Pooja. I'm really impressed by the organizational job you've obviously done. Have you had a lot of previous experience running large events?
This is literally my first event.
Oh my God. Wow.
It's so funny. Someone was just like, yeah, okay, now do this event. And I was like, yeah, I'm not an event planner. Let's see how this goes.
Okay.
Well, it looks like you did a great job. Thanks
Yeah.
for sharing, and yeah, if you don't mind sharing your docs.
Yeah.
Not at all. Not at all. Yeah, again, just like, just make sure you have your wait list process clarified, and you think about all the like the wait list snafus ahead of time, and then do your like organizational setup and be like very clear about what goes where, so that like that stuff doesn't get in the way when you have 2,400 people in line throughout the day freaking out about getting the vax in the first place and just wanting everything to go smoothly.
Sure.
Okay. It sounds like you were fairly tough about being a ward resident. I got to tell you something funny. I'm getting some kind of snarky emails from people saying that I live in the 40th ward, and I know that you 48 people came over to our event, so why can't I come to yours? So,
really?
Yeah. And I'm like, no, I think they really did stick to the boundaries, so I don't know.
I mean, we didn't stick to the boundaries in the sense that like we didn't have the capacity to like vet everybody's address before they came through. So we basically, it was like an honor system, right? Like we said, hey, like putting this out there, and we did that prior registration of folks we knew that were in the ward. So that, definitely we were like, we could say that we had registered people, enough people in the ward. And then we put it out to again, block clubs, teachers, etc. in the ward, and said, please keep it to the ward. And then in our registration splash page, we said like, hey, like, please only come if you're in the ward. And then the day before, we said, like the day before the event, we said, if there are any extra spots or if you want to be on this wait list and you're not in phase 1A, 1B, 1B plus, or if you're outside the ward, then please feel free to sign in. So like we kind of said that we're prioritizing people, but at the end of the day, like we don't have the capacity to check every single person's address and be like, you're not in the 40th ward, goodbye. Like there's no way for us to do that. And so we included everybody who signed up, like anyone who signed up, who had an appointment, who had registered through Eventbrite, like got in.
And that's exactly what we're gonna do. I'm acting like I'm tough, 6 days out.
On the front end.
when it comes to it, we're not going to turn anyone away, and we're certainly not going to be checking for proof of residency. And also, we're emphasizing like essential workers, restaurant workers in the ward, so they obviously will have out of ward addresses, and that's fine. So,
Absolutely.
Yeah, I think a lot of that just comes from like people's frustration and getting the
yes, yes,
Mhm.
yeah.
Unfortunately,
it's gonna happen. It's gonna happen. Yeah. I would say it's one missing piece that we had was like transportation. So to whatever extent, maybe you could get vaccine brigade or somebody, like if people can't get to the space, like we couldn't figure out transportation, especially to like older adults who were like, hey, I have nowhere to get there and CTA is going to take me 3 hours. So like, I can't do it. Is there any way that you could provide transportation assistance? And we couldn't, get that orderly in time. So if you have the capacity, think about that, especially y'all, Leslie, like since it's a little bit further away, like at least some folks, if you can assist transportation, that's something that
we have
like to have done.
about 15 volunteers that we are currently using to get people to vaccine appointments that we might be able to tap into. I don't know that we can get more than that though, right? Like that's pretty good number already, but
Oh yeah, that's terrific.
yeah, so we'll definitely keep that in mind. So thanks for that tip. We're leaning towards Willie White Park because it's in, a hard hit area of the city. And it's like the Howard area and it's right near a red line station too. So yeah, we'll see. We'll see what.
And is that outdoors or indoors?
We'd use their gym.
Okay, nice.
Yeah. So indoors, but if the weather's nice, we would hopefully just have people lining up outside, maybe even do observation outside, as much outdoors as possible.
Totally.
We're going to be towards the end of April, maybe even early May. Like, hopefully the weather's on our side for that.
Absolutely. And Ginger, where are y'all doing yours?
At the Broadway Armory.
Nice.
Yeah, Broadway and Thorndale.
Nice. How are you thinking about parking and like traffic control?
Well, yeah. So there's a small parking lot right next to it. Other than that, it's a problem. There is street parking and metered parking, and we'll go through all the same steps you did to try to ensure that. But people are very used to going to the Armory either by walking or public transportation or biking. So we're hoping it'll work out.
Nice. Great.
I mean, every year before this one, we've had a senior fair with 500 people there, which I always thought was a tremendous accomplishment. Now it seems like nothing to me, So, oh my God, what was I thinking? So,
Definitely.
But it's nice to know that you guys did it, especially for your first time, and that you survived. You look sane. You're still sane to me. So
I had to attend an environmental meeting right after the end of the event at 7:00, and I showed up and I was just like, hey, I might not be like the most coherent, good at explaining my point of view right now, but like I still showed up to the event.
Wow.
Right. I've already planned. I'm going to head to Moody's Pub right after the event.
Oh, I don't know what I'll do. I'll probably just go home and like take a bath and go to bed.
Eat a pack of hot Cheetos and pass out. That's really the only way to do it.
Ice cream, get some puppy cuddles in.
Yeah.
Yeah. Well, thank you so much, Pooja. Nice to see you, Leslie. If I have further questions, I'll let you know.
Yeah, please do. And good luck. Good luck with all this. It's really important. So like I'm glad we're being able to partner with folks and get the word out and do this for our folks. So yeah.
Great.
Thank you so much. Nice meeting you.
All right, you too. Have a good evening.
Thank you.
Bye.